Well, we're delighted to have with us today Sharon Lee, and she's an RN here to help us understand better a very interesting significance, and that is May is National Lyme Disease Month. And there is a Southern Oregon Lyme Disease support group here in Southern Oregon. And Sharon, nice to have you with us today. You're here to help us learn more about this.
Yes.
And you have taught nursing for years.
I did, 27 years, yes.
That's enough. Well, I know that was your passion as well, but you yourself have suffered from Lyme disease. Since when?
Since 1978.
I don't know how many people know what it is. I think few people know what Lyme disease really is.
On the East Coast, they do know what it is. On the West Coast, it's not as well known here, although it is here on the West Coast.
Is it a regional problem primarily?
It is in Oregon, in Southern Oregon primarily. It seems like a regional problem here. Also in all of California, but primarily Northern California.
Okay, so what is Lyme disease?
Lyme disease is a vector-borne illness, and by vector-borne I mean that it is transmitted by another source. Vector-borne means usually a bug of some sort. In this case, it's a tick that transmits Lyme disease.
And what's it affect? How does it affect you?
It affects eventually every part of the body. I'm in the late stage of Lyme disease, and I don't think there's been an organ in my body that Lyme disease hasn't affected over the years.
Really?
Primarily because I did not get diagnosed promptly and treated promptly. However, once I did get treated and diagnosed, I am doing far better than I was because I was on disability for 13 years.
Wow.
Yeah.
So what are some of the symptoms?
Symptom list is very long. I think I have a symptom list here for you somewhere here.
Yeah.
And it is probably one of the, I think there's probably 100 symptoms on there, because eventually it, like I say, it affects every part of our body. But it really is a disease in 3 stages. The first stage is usually from the tick bite to maybe anywhere from 2 weeks to a month later. And those symptoms are very, very mild. There may be a characteristic rash at the side of the bite. We call this a bullseye rash. It looks like a bullseye, red in the center, then an area of clearing, then another red area around it. And it's very characteristic. If you ever see that bullseye rash, which probably less than 40% of us have, that is only done with in being infected with Lyme disease. The other symptoms are like flu. You know, we have a low-grade fever, fatigue, muscle aches, joint pains, that sort of thing. Very, very nondescript. And a lot of people say they have a summer flu. And that should be a red flag because flu is usually in the wintertime. So if it doesn't get diagnosed and treated at that stage and goes to the next stage, stage 2, it then is pretty much throughout the body. And it can affect predominantly joints, muscles, heart, brain, spinal cord. And so the symptoms of those organs being involved can range anywhere from arthritic symptoms, and these arthritis symptoms often migrate. It goes from joint to joint. So like today, it would affect my knee. Tomorrow, it might affect my shoulder. And the knee goes away, so it migrates around to different joints. If it affects the heart, it's usually called electrical conduction problems, so rhythm changes will occur. And in some extreme cases like myself, I also had inflammation of the heart. I was in cardiac care unit for a couple of weeks. and it can be quite severe. I know of a couple of people that have actually ended up with heart attacks from having it infect their heart.
Wow. And stage 3?
Well, continuing on with stage 2, if it's in the brain, there's also very important symptoms that can occur or along nerve roots. People get very forgetful while it affects the brain because the brain is swelling up and it's being infected. People have had seizures, including myself, a lot of headaches. If it affects any of the nerve roots that come off of the spinal cord at any place, it can cause pain or weakness. And I've known people, one of the characteristic symptoms of this is called Bell's palsy, and it's actually it looks like the whole side of the face is drooping, and that's from a particular nerve that's involved in the face, and that's very characteristic of Lyme disease. Other people have had symptoms that look a lot like MS because it infects different nerve roots along the body.
Wow.
And then stage 3.
Yeah.
Is if you're not diagnosed and treated during stage 2 and it progresses on to stage 3, it can be any organ that's involved, the liver, the spleen, multiple joints have arthritis. It's not migrating anymore. It's really entrenched in those joints. And
does it show up in the blood at all?
It does show up in the blood, not as often as we would like, because the organism itself, it's called a Borrelia burgdorferi, and it's a little spirochete, and it has the ability to be pleomorphic, which means that it can morph, it can change form, and it can hide itself. So it has at least 3 different forms that it can present to our body at any given time. So some of those forms might be in the blood, some of them might not be in the blood. They might be deeply entrenched in tissue and not be in the blood. It also goes into a dormancy state for a period of time. And for instance, like myself, the tick bite occurred in spring, and I didn't have symptoms for almost 2 years after the first stage.
Wow.
And that's pretty common, I think, for this disease because it takes a long time sometimes.
Is it easily misdiagnosed?
Easily misdiagnosed.
For what? Like fibromyalgia or something like that?
Well, yes. There's fibromyalgia, chronic fatigue syndrome, and multiple sclerosis, lupus sometimes, arthritis sometimes. And the main reason that this disease is hard to diagnose is because the blood tests are not adequate.
Okay. That's why it moves around.
That's the primary thing. And there's not a lot of doctors who understand. We call them Lyme literate. They understand how to get a diagnosis, how to listen to the patients, all their symptoms, and put the whole picture together.
Right.
And for instance, myself, I went to probably 8 doctors before I finally found one who knew how to get a positive Lyme test.
Wow.
Prior to that, I had 5 negative Lyme tests.
Isn't that something? Because here you are a nurse, and you knew what questions to ask.
I did, and I knew what doctors to go to.
Yeah.
You know, I went to rheumatologists, I went to infectious disease doctors, I went to so many different doctors.
Wow.
The other problem that we have is that the common tests for Lyme disease check the body for antibodies. So if the organism is good at hiding itself and changing its form, then we don't make antibodies to it. Wow. So unfortunately, those are the main tests right now, are antibody tests.
Let me ask you this before we run out of time.
Sure.
What is the treatment?
The treatment primarily is long-term multiple antibiotics.
Really?
Long-term. I think for a period of time there, after I was properly diagnosed, I probably took 5 years of antibiotics. But then I'd had it for a long, long time. So a person who is newly diagnosed in the first stage the best treatment is probably 6 weeks or more of an antibiotic. My husband, for instance, had Lyme disease. He took antibiotics from a Lyme literate doctor for 6 months, and he no longer has symptoms.
Wow. And you're feeling better?
I am feeling better. Like I said, I went back to work after being disabled and worked 8 years after my disability was over.
Wow.
And so I feel very fortunate that I found somebody.
What do you want people to do? I mean, can we get how do we get more information to those who may want to investigate this and find out more?
They can call me. My number is 541 879-0222.
Okay.
We also have meetings once a month, and we meet on the third Thursday of each month at the Smullen Center at Rogue Valley Hospital from 6:30 to 8:30, and they can just show up at our meetings.
All right. Again, if you want to get a hold of Sharon, it's 541-879-0222. Let me ask you this. I would assume now more doctors are becoming aware of it, hopefully.
They are on the East Coast.
Okay.
Not as much in the state of Oregon, unfortunately. We have maybe 4 Lyme literate doctors in the entire state.
Really?
Yes, and the numbers, the statistics for our state are woefully small.
Okay.
For instance, in the entire nation, there is something like 3 million cases in the last 10 years.
Wow.
In this state, there were 393 cases.
Wow.
So one of the problems is there is nobody reporting these cases to our state. We know that they're here because I've had at least 150 people contact me just in the 2 years since we've had our Lyme disease support group.
Wow, this is fascinating. And is it curable?
I think if caught in the early stages, it is, and that's the key. Mm-hmm. Catch it in the first stage, possibly in the second stage, early in the second stage. I don't think that I will ever be cured of it. But then we just now have a new lab back on the East Coast that is doing cultures, and that's going to help us. And there's some nanotechnology that's out looking at very small particles of substances in the blood, and perhaps we can find these different forms and confirm that you still have an infection.
Well, let me just say to our listeners and viewers, if you've been bit by a tick, you need to get checked out fast and right away. And if you want to talk to Sharon, her phone number is 541-879-0222. And you may want to go to one of these support group meetings. She can give you all of the information when you give her a buzz. But don't take tick bites lightly. And I can tell you that I've seen the effects of this. I know friends that have had this disease, and I'm telling you, it's very painful and very debilitating, isn't it?
It's lifelong, can be changing lifelong if you don't get it early enough or treat it.
But it can be treated.
Mm-hmm.
It can be cured. Just get on it right away.
And I'd also like to say that what we're at is prevention. Mm-hmm. Getting the word out and helping people to understand how to prevent getting bitten by a tick is very important. So our tick-infested areas or habitat in Southern Oregon is primarily the oak leaf littered forests. So the nymphs are the ones, the very, very tiny ones that you can't even see are the ones that are most effective. They reside in that area, and so you want to avoid that area if you can. If you can't, then wear long pants, tuck your pants into your socks, and make sure it's light colored so that you can see the ticks crawling on the outside.
There you go.
Do a tick check every day.
All right, thank you, Sharon. And again, Sharon's phone number 879-0222 if you need any more information about Lyme disease, especially what few days we have left in the month of May. It is Lyme Disease Awareness Month. Thank you, Sharon, for being with us.
You're very welcome.
Okay.